Good afternoon. Thank you for joining us again today. I'm joined today by the Deputy First Minister and by the Deputy Chief Medical Officer, Dr Nicola Steedman. I'll start with the usual update on the COVID-19 statistics. An additional 11 positive cases were confirmed yesterday, which takes the total now to 18,384. A total of 630 patients are currently in hospital with the virus, either confirmed or suspected. That is 19 more than yesterday, but it includes a reduction of 9 in the number of confirmed cases. A total of 6 people last night were in intensive care with confirmed or suspected COVID. That's the same number overall as yesterday, but an increase of 1 in the number of confirmed cases. Since 5th March, a total of 4,138 patients who had tested positive and been admitted to hospital have now been able to leave hospital. During the past 24 hours, 1 death was registered of a patient confirmed through a test as having COVID, and the total number of deaths under this particular measure is now 2,491. Now, even 1 death is, of course, one too many. But for us to have had just 1 registered death of a confirmed case in 8 days is a sign of the progress we have made. That said, the total number of deaths is a painful reminder of the heavy toll that this virus has taken. So once again, my thoughts are with everyone who has lost a loved one. We will also today publish updated information about the prevalence of the virus in Scotland. Our modelling suggests that the R number, the average number of people infected by one other infectious person, remains below 1, and the number of people in Scotland with the virus continues to fall. Our central estimate for last week is that 700 people in Scotland were infectious. And again, these figures are a sign of the considerable progress that has been made. And so, as I always do, I want to thank everybody who has contributed to that, including every single member of the public across the country, but in particular our health and care workers for the remarkable job that you do and indeed continue to do in very difficult circumstances. There are 3 issues I want to briefly cover today. The first is childcare, an issue that is hugely important for families across the country, but also hugely important for the economy. And today's job figures published earlier this morning highlight again the economic impact of the pandemic and the importance of government and everybody working hard to counter that in the weeks and months ahead. As you know, childcare services were able to reopen fully yesterday, and John Swinney will talk a bit more about the childcare that is available now and which will be available in the months ahead. Before that, though, I want to take this opportunity to thank everybody who works in childcare for all of your efforts to enable children to return safely. It is hugely appreciated by all of us. I also want to thank parents and carers. I can only imagine how much disruption that the closure of childcare settings has caused for you over these past few months. But I want to thank you for understanding why it has been necessary and for managing throughout this period, sometimes I know in very difficult circumstances indeed. And finally, in the probably unlikely event that any of you are watching this briefing right now, I want to say again thank you to all of the children across the country who have been affected by the closure of childcare facilities and of schools. I hope that in the past few days you've been able to play with your friends a bit more, and I hope that you're looking forward to going back to nursery or in a few weeks' time going back to school. But I know how difficult it has been for you to stay indoors for much of the time over the past few months, and I know that not being able to see your pals hasn't been much fun at all, but you have all been brilliant, and I want you to know that everybody is really proud of you. The second issue I want to cover today is shielding. The statistics now show that the prevalence of the virus in Scotland is low, and it is at this stage getting lower. That means we can update our advice to people who are shielding in line with the route map that we set out for you last week. From tomorrow, therefore, we advise that you can, if you wish, stay in any holiday accommodation, including hotels and bed and breakfasts. You can also visit outdoor markets and public gardens. And in a change that I hope will be particularly welcome, non-cohabiting couples can meet without physical distancing, even if one or both of you is shielding, and even if neither of you lives on your own. Now, we hope to be able to pause the need for shielding altogether at the end of this month, although even if we do that, we will still encourage those in the shielding group to take extra care in things like physical distancing and hygiene. And I know that the prospect of returning to something more like your normal lives will be welcome for many of you, if not all of you. But I appreciate it that it is also likely to be quite daunting. So the Scottish Government will provide more information for you nearer the time, and we'll do everything we can to support you in this transition. In addition, the Economy Secretary has asked the UK Government to ensure ongoing financial support for anyone who has been shielding and who may not be able to go back to work or to work from home. In addition, I think that those of us who aren't shielding should also be thinking about how we can help all of you during this transition. Wearing masks in shops and on public transport, making sure we all keep 2 metres distance away from others whenever possible. That's the best way we can all help to give shielding people the confidence to go out and about again safely. And if you are an employer, please be sensitive to the concerns of any employees who may be shielding. If it turns out that we are able to confirm next week that shielding will be paused from the 31st of July, please reach out to people who might be going back to work, have honest conversations about how you can support them, and try to think creatively about how you can make your workplace safer for them. As I've said before, the relaxation of shielding measures is good news, but it will be prompting some understandable stress and anxiety. So all of us, I think, can take sometimes small steps that might make a big difference to people who are shielding. Now, the final issue I want to cover relates to mental health. Most of the focus of COVID so far, for very obvious reasons, has been on its physical impact. But we are also increasingly thinking about the mental health of people who have had COVID. There are now, for example, more than 500 people who have been discharged from intensive care or high dependency units in Scotland. And being in intensive care is obviously a traumatic experience, and many COVID patients have had to go through that without any prospect of being visited by friends and family at any time while they've been in hospital. So although we know that most people will make a full recovery with the help of their loved ones, some people we know will need additional support. Scotland already has a very effective programme which is used by several health boards for helping patients who have been in intensive care. The Inspire programme uses specialists from different disciplines. It puts former intensive care patients in touch with other people who've had the same experiences, and it encourages them to join community organisations or other groups which can help them through. And so we plan to learn from that in supporting COVID patients. And I'm delighted to confirm today that Dr Nadine Cassette, a psychiatrist with NHS Lothian, has agreed to lead on this work. And I think it's an important way of ensuring that people who have had COVID get the long-term help that they may well need to recover. Now, before I hand over to John Swinney and then to Dr Steedman, I want to stress again today that as the figures demonstrate, we have now got to a position, it's been hard-earned and it has not been easy, but we've now got to a position where, at this stage, there are very low levels of the virus in Scotland. However, as you hear me say every single day, the only way to ensure that things remain that way is to continue to stick to the rules. Every single one of us have a duty, and I think it is a duty that all of us have as citizens, to remember that the decisions we take as individuals right now have an impact on the collective well-being of all of us. And that is more important now as we emerge from lockdown than it has been at any point over the past 4 months. So I want again to remind everyone of facts, the 5 key, vitally important things that all of us should remember in absolutely everything we do. Face coverings should be worn in enclosed spaces. They are mandatory in shops and on public transport, but our advice is in any enclosed space where physical distancing might be more difficult, wear a face covering. Avoid crowded places, not just crowded places indoors, that is especially important, but even outdoors, avoid crowded places. Clean your hands regularly and thoroughly, and if you're touching hard surfaces, clean them too. 2 metre distancing remains the general rule and the strong advice we give to everyone. And self-isolate and book a test if you have symptoms. Remember, if you have a new cough, if you have a fever, if you suffer a loss of or a change in your sense of taste or smell, don't wait to see if you feel better, act immediately. Self-isolate and go to the NHS Inform website and book a test. It is by doing that that you give our test and protect system the opportunity to break the chains of transmission. So if all of us remember these 5 basic measures, all of us can help to stay safe, protect others and save lives. So my thanks again to everyone who's doing the right thing and sticking with these rules. If we all keep doing it, then we will continue to make the progress that we've seen in recent weeks. Thank you for listening. I'll hand over now to the Deputy First Minister and then to Nicola, and we'll take questions after that as usual. John.
Thank you, First Minister. I'm going to give an update about childcare and also the reopening of schools. I'd like to express my thanks to teachers, parents and to children for their engagement in learning over the period of lockdown. I know it's been a tough and demanding time, and I'm very grateful to everyone for their extraordinary efforts that have been put in place to support our children and young people. I'd also like to extend my thanks to the outstanding childcare staff of Scotland. Day in and day out, you work incredibly hard, providing a loving, nurturing environment that is a foundation for a positive future for our youngest children. Childcare has carried on during the pandemic. Key worker childcare was at the heart of keeping Scotland going during lockdown. Without it, Scotland could not have responded to the COVID-19 pandemic the way that we did. And I extend my warmest thanks to you for your efforts. In phase 1 of the relaxation of lockdown, all childminders and fully outdoor childcare provision were able to reopen. Last week, the First Minister announced that from the 10th of July, informal childcare and the use of nannies could resume. And from yesterday, all other early learning and childcare settings were able to open. Looking ahead, I expect term-time childcare settings will reopen in line with schools next month. This will be welcome news to parents, families, the childcare workforce and, most importantly, to children. It is important to remember that this reopening is not a return to normal. Childcare will look and will feel a bit different. Some public health restrictions will remain in place at that time. These are about keeping children, staff, parents and the wider community safe. At their heart is the need to reduce the overall number of contacts that we each have in order that we can suppress the virus. We've issued guidance for the safe reopening of early learning and childcare and school-aged childcare services that was created in collaboration with the sector and focuses on child and staff wellbeing and safety. This approach means that providers have had to adapt their approach. It will have had an impact on how many children can attend a setting and may mean settings have had to spend money to reopen safely. I want to make clear that I do not want to keep these restrictions in place any longer than is necessary. And I'm pleased therefore to say that we've now received further scientific advice on these issues and we will be developing fresh guidance. If the virus continues to be suppressed, if we stay on track, then we can start to ease these restrictions. We will work with the early learning and childcare sector to issue revised guidance by the end of July to take effect in August. This will not be a return to normal childcare operations, but we now expect that the bubbles model that restricts children to small groups will not be needed. And we'll be able to ease the complete ban on mixing or blending different types of childcare, such as childminding and nurseries. I hope this will be welcome news for the sector and for parents. Lastly, on childcare, I know it's been difficult for the private and third sector during COVID-19. And I know that the transition to the new way of working that the virus requires, of increased cleaning, additional equipment, developing outdoor space and adaptations to support the physical distancing of adults will all mean more financial pressure. The childcare sector is essential to our economic recovery. I'm therefore announcing that we will create a transitional fund for the childcare sector to the value of £11.2 million to financially support the reopening of childcare services. I'm also delighted to announce that today a new workforce support fund for childminders is opening for applications. It will see the Scottish Government and the Scottish Childminding Association jointly provide grants to childminders to help them adapt to the reality of the virus. Turning finally to schools, work is ongoing to plan for the safe resumption of full-time schooling for all pupils in August. This morning we have published the scientific advice that will inform the approach that is taken to plan for this aim. This advice remains conditional on general community factors such as reductions in infection rates, confidence in surveillance measures, and a process for handling local outbreaks, all of which will be informed by the advice of the COVID-19 Advisory Group on Education and Children's Issues. The advice we have now received, however, sets out that no physical distancing is required between children and young people in primary and secondary schools. The advice also states that school transport, dedicated services such as school buses, also do not need to have physical distancing within them as long as infection rates remain low. We will continue to work with councils, professional bodies, trade unions and parents to develop the guidance that schools need to successfully reopen next month. And subject to Parliament's agreement, I plan to make a further statement to Parliament next week on this vital commitment.
And Dr. Steedman.
Thank you. So today I actually want to talk to you about something a little bit different, about data and surveillance and how we can use this to help us in our approach to coronavirus across Scotland. So I want to start you by encouraging you to think about the concept of what lies beneath. So generally, when you hear the positive testing numbers here that we tell you about every day, this is mostly in those people who've been tested for coronavirus because they have symptoms. So if you think about coronavirus in Scotland as an iceberg in the water, then these positive tests are like the top of that iceberg that we can see above the waterline. But one of the things that we do know about this virus is that a proportion of people who get the virus either have very mild or, in fact, many times no symptoms at all. And if you like, that's the bottom of the iceberg beneath the water. And that's the part that we can't see as well, the part that's much harder to detect. Now, this is important because if we want to work out the true number of infections with coronavirus in Scotland and to establish the extent with which the infection has spread across the country, then of course we need to know about the whole iceberg. And that's where surveillance comes in. So one of the methods that we use for surveillance is antibody testing, and you may well have heard things about antibody testing in the press recently. And for those who don't know, antibodies are specific proteins that your body makes when you're fighting any kind of infection. And if you're infected with coronavirus, your immune system responds by producing these proteins, these antibodies, to help to fight the virus. And after you've recovered from coronavirus, these very specific coronavirus antibodies actually stay in your blood afterward for some time, at least probably for several weeks. And interestingly, this happens whether you have symptoms or whether you don't. So this, if we look at antibodies across the population, allows us to measure the whole of the iceberg, if you like, in terms of COVID in the population in Scotland. Now, the Public Health Scotland Serology Surveillance Programme uses blood samples that have been taken for any reason within community healthcare and other settings on an anonymous basis to estimate the proportion of people in Scotland who have these antibodies to coronavirus, and this is known as seroprevalence. And yesterday, Public Health Scotland published their first report on this work, which is what I want to tell you about today. Just to note, the report provides an analysis of samples which were collected between the end of April and the end of June this year, and it covers approximately 4,751 tests which were submitted to Public Health Scotland for these surveillance purposes. So the results, well, the work estimates that the proportion of people across Scotland who had antibodies to coronavirus during this time period is approximately 4.3%. So that's 4.3%. And what does that mean for all of us? Well, I don't think I need to tell you that it means that only a fairly small proportion of the population have so far likely been exposed to coronavirus in Scotland. And it's this low number of people likely exposed that explains, I think, and reinforces our ongoing messages to you. Firstly, that we need to be careful when we're easing out of lockdown. And secondly, this is why we still want you to follow all of the current guidance on physical distancing and all the other measures that we recommend in order to protect you, your loved ones, and in fact, to protect all of us. Now, I want to just reassure you about how this type of research, this type of surveillance is undertaken. In order to do this kind of analysis, we do need to use anonymised patient data from GP surgeries from across the whole of Scotland. And this is what allows us to scale up this analysis to create a picture for the whole population. It also allows us, if we want to break the data down to focus on particular groups in the population or different areas of the country. Health Protection Scotland have engaged with the Royal College of General Practitioners and the Scottish GP Committee of the British Medical Association before undertaking this research, and they have both endorsed this essential approach to surveillance. The required data that we get from all the GP systems across Scotland comes to us, but it is anonymised. Patient details are completely replaced with an anonymous study code, and only once personal details are removed can the data actually be used. So that is there to reassure you. And I can absolutely state that data privacy is a priority for all of us, and you should be reassured that the data that we use for surveillance is limited only to these sorts of important processes in terms of COVID research, and it's very strictly governed by the COVID-19 Public Benefit and Privacy Panel process, so that it's all assured. But because we are using this anonymised GP data, and because we think you should know about this, we've provided information on the Health Protection Scotland website because we want to share this with everyone. So please do read this if you have any concerns at all about the use of your, and indeed my, anonymised data in this type of work. But I hope that from what I've told you, you can see how important this work is and how important the data is, and also be reassured that we are taking all the steps to protect your confidentiality. In the end, the better our understanding of COVID-19, then the better placed we are to limit the effects that it has, and to give you the best possible advice in terms of how to protect yourself and your loved ones. So you can find more information about the work I've mentioned on the Health Protection Scotland website, and the full report on the seroprevalence work on the Public Health Scotland website. And I just want to finish by thanking Public Health Scotland for this work that they've undertaken. Although I've just given you this one estimated figure, 4.3% of the population with antibodies to COVID, this is underpinned by months of painstaking work by people in Public Health Scotland, and we're very grateful to them. And it's as a result of this that we are helped in terms of the information about what lies beneath and what this means for all of us in the next critical stages of our COVID journey.
Thank you very much, Nicola. We'll move now to questions. Today, the first question is from Lucy White at BBC Scotland.
Good afternoon. Just on schools, given that this scientific guidance now seems to support what is the plan to go back full-time, how confident can parents and teachers be that that is what's going to happen at the start of August? And also in that guidance, it does say the evidence isn't as clear around older children. So can you reassure them and their families that their safety will be paramount?
I'll hand over to Deputy First Minister just in a second, because just to be very clear, what's been published today is some scientific advice. It's not guidance. We now have to turn that into guidance, and that will involve the discussions that John referred to earlier. And the advice is telling us what they think is possible, assuming we keep the prevalence of the virus as low as it is just now, if not lower, preferably. But of course, we will then have to have conversations with parent groups, teachers, councils, to determine what is acceptable, if you like, in terms of assurance and the safety of both pupils and teachers in schools. And that's what the guidance will seek to do. And safety is absolutely paramount. And yes, it is our hope and ambition and intention that schools can return full-time in August, but that depends on us continuing to see this virus suppressed to the levels, if not lower, than we're seeing today. And that, of course, involves all of us continuing to do the right things. John.
Thanks, First Minister. We are at a very critical point in this judgment, because clearly we are experiencing very low levels of infectiousness within Scotland. The First Minister has given the update on that level just now. And that factor is a strong factor in being confident about being able to reopen schools in August full time. It corresponds directly to the advice of the World Health Organization, who commented just the other day that the best and safest way to reopen schools is in the context of low community transmission that has been effectively suppressed by a broad-based comprehensive strategy. Now, that's what we have achieved in Scotland by the tremendous compliance and participation of members of the public. But yesterday, we undertook the most significant relaxation of the lockdown since it began. So there's obviously risks that by relaxing lockdown, there is potentially some greater opportunity for the virus to spread. So that's why, if we want to reopen schools full-time in August, we appeal for the maximum amount of cooperation and compliance from members of the public with all of the guidance that we have given to make sure that we can achieve that objective, which is what we are planning to deliver. Now, lastly, on the question of older pupils, we have to look very carefully at this advice, and we have to look at it within the context of education to determine if there are additional measures that we need to take, because the advice is unequivocal in relation to younger pupils. It's more equivocal in relation to older pupils, and these are some of the practical issues that we will discuss with our local authority partners, with the professional associations, with parents groups, and also with young people themselves.
Ewan Petrie from STV.
Thank you, First Minister. Just picking up on a few points there. Are you saying then that you will consider additional mitigation measures being put in place for senior pupils in school? And given the time frame here, we're approaching the start of term, will teachers be aware of that so that they can put these measures in place? And also, will staff be subject to routine testing as well?
Look, on the issue of testing, that continues to be under consideration in terms of the role that testing might play in this. But yes, we will always consider additional mitigations if that helps build public confidence and allow us to get, keep the virus suppressed and get society, the economy, and in this context, schools back to normal as quickly and as far as possible. As John said earlier on, he hoped to make a statement to Parliament next week, which will give an update, because of course we want teachers, parents and others to be fully aware of the environment in which they'll be operating come the return of schools in August. John?
Let me just add to that. There's a huge amount of detailed work going on to make it possible for schools to return full-time in August. That will require us to have in place mitigation measures, and this advice is crucial in designing what those mitigation measures will have to be, as is the dialogue with our partners about how we formulate that guidance and define what's involved. But there will have to be mitigation measures to make sure it is safe for us to reopen schools, to protect the position that we have achieved up until now, and to make sure that parents and young people and staff can be assured that schools are a safe environment in which to be educated. So those considerations will be at the centre of how we look at this advice and how we turn that into practical guidance. And lastly, in terms, we've been very clear that a decision on to confirm whether we could reopen schools full-time would be taken at the next formal review of the lockdown, which is on the 30th of July. I believe that gives ample opportunity for us to set out very clearly what the arrangements will be, and we're working with our partners to make sure that we can achieve that objective.
DCMO wants to add?
I think the only thing that I was going to add is that as well as the considerations in terms of what we advise pupils themselves to do, these are not the only things which are potentially going to be put in place for schools. There will also be advice on what schools should do, for example, if they are worried that a child may have symptoms or a pupil may have symptoms. And we are also having discussions with our National Public Health Agency about putting in place some sort of surveillance programme potentially for schools. It's not quite clear yet what that will look like, and we will take the advice of the experts on that. So this is, there are a raft of measures which we are putting in place which will give the best reassurance for parents and for children. And I think just to finish, we know clearly as well the harms that result from children not being in education, and that's something that we always need to bear in mind as well. But we will put everything in place that needs to give parents, children and teachers the reassurance that what we are advising is safe for all of them.
And I guess that's the watchwords for us are safety and assurance. Safety, take it as read. We want to be as assured as we possibly can be that children and teachers in schools are safe, but it's not enough for us to say that. We have to assure parents and teachers and young people of that. So safety and assurance are the guiding principles here as we take forward this evidence and turn that into the practical guidance that we've been talking about today. Tom Sheldrick from ITV Border.
Thank you. First Minister, the UK government says that in recovering from the coronavirus crisis, it's vital to work together. They've published a white paper today on their plans for the UK internal market, saying they're focused on making sure trade within the UK is seamless. Please can I ask you if it's also a priority for you to make sure people can work and trade without barriers, for example, over the border between Scotland and England, and why has your party described these plans as a power grab?
Well, we're straying slightly off the coronavirus territory here, and I've been pretty strict in trying not to do that, because this is an update and a briefing on COVID. The internal market white paper today we have responded to and will engage with that. On COVID, I have tried and will continue to try in most respects successfully to work together with other administrations across the UK, but being very clear, my responsibility is to take decisions that are right for Scotland in the circumstances we face, and I will not depart from that. In short, with the white paper on the internal market, this is not about not working together, it's about riding and not wanting to see the UK government ride roughshod over the powers of the Scottish Parliament. This effectively would allow the UK government to decide issues of food standards or consumer standards, environmental standards that right now are decisions for the Scottish Parliament. Retrospectively, that could have meant, for example, the Scottish Parliament not being able to legislate for minimum pricing for alcohol or not being able to stop GM crops. So these are important issues of principle, and it's about the ability of the democratically elected Parliament of Scotland to take decisions in the powers that we have based on what we consider to be right for Scotland. But we'll have other opportunities to discuss that more fully, and I think probably for the purposes of this briefing I will stick to issues COVID. Jack Foster from Global.
Good afternoon to all of you. We've seen advice published today on the subject of education that in order to reduce the risk of transmission from people moving in and out of different sites, there could be a need to reduce contact with the likes of social workers, psychologists and voluntary staff. Given the generally accepted likelihood of a spike in demand for mental health provision as a result of this pandemic, is there a risk that a policy like that could exacerbate an already worsening problem?
Look, everything we're having to do to deal with COVID right now has consequences, and that's why in all of the work that the Scottish Government has done, we've recognised the interlinked harms, the four harms. We're having to take actions to get COVID suppressed and now to keep it suppressed, but that has meant children not being in school, it's meant lots of people not being able to work, it's meant people not being able to see their families, so that has a whole host of other consequences that do harm to people. So unfortunately that's what we are grappling with right now, and in some respects we're having to find new ways of doing things so people still have access to the services, because your question is absolutely right, people need access to the kind of services you're talking about. But if, for the purposes of suppressing COVID, they have to be delivered in a slightly different way, that's the challenge that we face. And these things are not easy, but we have to try to strike the right balances to meet all of these competing objectives. Nicola, do you want to say any more about the four harms?
I think you're absolutely right. It is a balance of harms. We know the harm that COVID causes, but we also know that some of the things that we've put in place contribute to other types of harm, and it is a very delicate balancing act, but it is one that we are very aware of. And I think that you're absolutely right again, First Minister. We don't rule out essential services. If people need to have essential services, then they have essential services, but how we undertake those may be different. So I think we're not saying no to any of these things. We're saying that we need to think very carefully about the balance of harm and how we might mitigate against that. So we might need to do things slightly differently to get the best possible outcome for children.
Thanks. Andrew?
Just two brief points from me, First Minister. The first is that we have to balance a number of risks, and what that advice is pointing to is minimising the range of contacts and the circulation of individuals within education settings, which we may need to reduce to create a safe environment. Now, there are, of course, other ways in which services can be delivered in managing that particular risk. The second point is very specific on mental health support within schools. And the government has given a commitment to work to appoint a mental health counsellor, or to have one available in every single school in our country. And that's what every single secondary school. And that commitment is being developed and taken forward with our local authority partners. We're making very good progress on that, and we expect to be in a point of completing that programme in the autumn. So there will be that type of advisory support available in schools to provide the assistance to children and young people who require it.
Neil Pooran from PA.
Thanks, First Minister. If I could perhaps ask the Education Secretary, the report out today mentions possibility of additional protections for people from Black and ethnic minority communities. I was wondering if you could perhaps set out what some of those might be, given the other data we've had recently on the higher death rate for COVID among South Asian people.
Thanks for the question, Neil. It's a very important point, because we have to make sure that everyone within our society is properly supported in establishing the return to education. Now, what we will look at in turning that advice into practical guidance is the type of measures that can be in place, whether it's around the issues around testing regimes, or whether it's in relation to specific support in terms of mitigating risk, to make it practical and possible for all staff and pupils from a BME background are able to fully participate within our education system. So we will look at all possible measures that we can take to adapt our education system to respond significantly and substantially to the advice that we've received.
Okay, thanks. Scott McNabb from the Scotsman.
Thank you, First Minister. Reports in the last 24 hours indicate increasing optimism about the prospect of a vaccine being in place maybe by the end of the year, early next year. Can you tell us about the planning that's been undertaken for distribution of a vaccine in Scotland when it finally arrives? Would there be specific groups which are targeted to get it first? And might it be compulsory? And also, if I might, you've talked previously about total elimination in Scotland, which would involve some cases still being around in the community. I'm wondering, when you refer to the low levels which we've reached now, do you think we're at that stage of elimination?
Thanks, Scott. I'll hand over to the DCMO in a minute, who may want to say a bit more about vaccine and both the prospects of that, but also our own planning here in Scotland. On that, first of all, I mean, I'll describe this as I have everything crossed for the best possible news on a vaccine as early as possible. And I certainly, like everybody else, my heart soars a little bit every time I hear or read something of the nature that we're reading in some of today's media. That said, I remain cautious because, you know, I don't think we should take anything for granted. Vaccine development, and I am by no means an expert. On the contrary, I'm anything but an expert on this, but I know enough to know that it's not straightforward and it is very, very complex. So I don't think we should count our chickens before they're hatched in that respect. In terms of the decisions, I guess the decisions we would take would flow to some extent from the nature and the amount of vaccine that we had available. I think for all of the positivity, it's still unclear if there was an effective vaccine soon, whether relatively soon, how much protection that would give, what the nature of that protection might be, and of course what the quantity of vaccine we might have in the short to medium term. So we haven't taken any decisions around this yet because we are not able to do it given the state of things at the moment. But I guess if we were having to prioritise groups within the population, the elderly or people in the shielded category would certainly be in there as groups that you would want to see prioritised given the nature of the virus and what we know about the groups that it most affects. And finally, on the elimination point, as you've heard me say before, and as you've heard lots of people that are much more expert than me say before, elimination is not the same as eradication. We're not going to eradicate this virus, probably, I suspect, Nicola, without a vaccine. Elimination is getting it to the lowest possible levels. but it's not a fixed point in time either. So you drive it as low as possible, but then you've got to work really, really hard to keep it that low. Are we at effective elimination right now? I suspect we're a wee bit off that still because the numbers of new cases we're seeing every day, but I think we're very, very close to it. And that is why I keep saying let's keep at this so that we get it as low as possible. That gives us the best chance of getting our schools back full time in August and getting back to as much normality as possible. But it involves all of us doing the right things. And the last point I would make is, and you've heard me talk about Melbourne before, not because I'm picking on Melbourne, because it's the example that certainly gives me most pause for thought just now, that the difference between being tantalisingly close to elimination and being in lockdown again because it's running out of control is a very, very fine one. And this can go into reverse very quickly and very easily if we don't all keep doing the right things. So please, everybody, keep doing the right things. Nicola, do you want to say a bit more about vaccine?
Thank you. Yes, I think a safe and effective COVID vaccine is not just an exciting prospect, it's something we all want. I think we're all agreed on that. And we are delighted that the universities of Edinburgh and Glasgow are working with NHS colleagues and are taking part in human safety trials for the development of a COVID vaccine in association with Oxford University. So we are right at the heart of this vaccine development front. And there, as you say, there are reports that some doses of the vaccine, if it is effective, may be available, as early as before the winter season, possibly even October. But the First Minister is absolutely right. First of all, we need to see results in terms of what this vaccine can do. Having said that, we are planning on the basis of a vaccine being available because we need to put things in place well in advance for that in order to be ready as soon as hopefully a safe and effective vaccine comes. So we're starting on a good footing. We have a very good immunisation programme generally across Scotland. We have the highest rates of childhood immunisation across the UK, along with Northern Ireland. And so with the Scottish immunisation programme, we're starting on a very good footing for being ready for a vaccination programme when a successful vaccine comes along. But obviously we need to substantially upscale this, and we are establishing a vaccine programme board to oversee that upscaling, and that is happening as we speak. So we are very aware and putting in place the things that we will need to do to be able to roll this out. In terms of prioritisation of groups who might get the vaccine if there are limited doses available, then the First Minister has outlined some very good, incredible candidate groups for that. And generally speaking, we would take advice on that from the Joint Committee on Vaccination and Immunisation, who have considered whether prioritisation of a COVID vaccine should take place and will report on that in due course. And then we come to elimination. It's a continuous journey, elimination. We want to keep the virus as low as possible. It is likely to go up and down even at low levels for some time to come. And so I think we need to be realistic about what we mean by elimination and also that this is not going to be something which just happens overnight. But there's no doubt about it that if we can get a safe and effective vaccine, it will help in our goal of elimination.
Thanks, Nicola. Tom Martin from the Daily Express.
Hi, thank you, First Minister. Just going back to schools, today's report talks about putting smaller groups in place. I just wondered if I could get a little bit more detail of what might be the thinking around that, what kind of circumstances, settings, because the latest figures from last year suggested average class sizes in primary were still sat at about 23.5 pupils. So I just wondered how feasible, what kind of circumstances are we looking at in terms of numbers and sizes to get this working?
Okay, I'll hand over to DFM.
I think on this question, I think this particular point is most relevant in relation to senior phase pupils in S4 to S6, where quite clearly the report differentiates, as I mentioned earlier, between the position of younger and older pupils. The report is very clear that in primary education there is no requirement for physical distancing. So we'd have to consider that, I think, very specifically in relation to the senior phase to make sure that groups were of an appropriate size, bearing in mind that we are essentially dealing with groups of of young adults. So it's in that sector that I would imagine we'd be looking at those particular considerations.
Vivian Aitken from The Record.
Good afternoon. Can I also ask about schools? We talked earlier about movement of people in and out of schools. Would that also mean that children in the senior phase would be prevented from going to other schools to do, for example, advanced hires? Not all schools provide the full range of hires, and some have to move from one school to another, and also to go to colleges. Just really wondered what would be involved in helping pupils who don't have a specific subject in their own school to get that.
I'll hand over to the DFM again. I'll just make the preliminary point that, as John has already said, these discussions are still underway and taking place in the context of the Education Recovery Group, but it's important that all of these points of detail are properly thought through and considered and then translated into guidance. But John, do you want to address the particular point?
This is one of the issues, the very practical issues that we'll have to wrestle with, and one of the points which the report makes strongly is to try to minimise movement in and out of schools and around schools as far as possible. So the point that you raise, Vivian, is a valid issue for consideration. Now, one of the things that we're taking forward is a digital platform which is being developed by Education Scotland and by the eSchool in the Western Isles, which is about essentially enabling us to have the ability to record lessons in different parts of the country for them to be broadcast right across the country to any learner that wants to be able to interact with that learning. Now, that's been underway. It's been piloted in the north of Scotland for some time. This is a venture that's been financially supported by the government and by the Western Isles Council. And it gives us a really strong platform to make sure that although we may have to restrict the physical movement of pupils, it means they will still have access to high quality learning. It will just be delivered by digital means as an alternative. So there are contingencies in place to try to address some of those issues if we had to get to the situation of addressing the issue that you've raised with us, Vivian.
Thanks. Libby Brooks from The Guardian.
Hello, First Minister. If I could direct this to the Deputy FM. You'll be aware of the criticisms from Scotland's Children's Commissioner earlier today that children's rights went out the window during lockdown. And I just wanted to ask whether you were going to consider including children and young people's voices in the Education Recovery Group from now on, or sort of what other plans you might have to involve young people in post-lockdown decision-making.
I think you address it to John, so I'll hand it to John.
We've taken forward a number of discussions with young people about their experience of lockdown and their hopes for the return to formal schooling. And it's important we hear and experience that voice of young people. In that respect, I agree entirely with the Children's Commissioner about the importance of that being the case. We also look very carefully at some of the material that's been developed through the work of Young Scot, which is fabulously well connected with young people around the country in their analysis of lockdown lowdown, which gives us direct feedback from young people about their concerns, their hopes and their aspirations in seeing the restoration of full-time schooling. So I think it's important we learn from those contributions that young people are making. It's important we listen to that contribution. The government's doing it, our local authority partners are doing it, a range of different organisations are doing that to inform the deliberations that we are taking forward. So I'm very committed to making sure we hear that voice and to reflecting it in the policy decisions that we take forward.
Thanks. Rachel Watson from the Mail.
Thank you. This is for the Deputy First Minister as well. Just on the schools return as well, the report talks about limiting cross-class activities. Does this include things like lunch breaks and break times and who children can speak to and play with within the school? Will they be encouraged to stay within their own class groups and kind of eat within the classroom? And also on face masks for teachers, it talks about working face-to-face with children for 15 minutes. Could you provide some examples of when a teacher might have to wear a face mask in the classroom?
On the first point, Rachel, we want to minimise the restrictions that are in place for young people. Indeed, as a government, we set out changes to the arrangements which would allow young people, prior to schools reopening just now actually, in which they can interact and interrelate with their peers much more actively than was the case during lockdown. So we want to try to minimise those issues, but where there are examples where moving around schools or where there's particular activities, you mentioned lunch breaks, there may be ways to mitigate the risks of the possible circulation of the virus, then we will of course explore those opportunities. So there may be practical issues that arise out of the implementation of some of that advice. When it comes to the question of face masks and face coverings, I think we've got to remain open to this question in some limited circumstances. I think the advice is very clear that in younger pupils, the risk of transmission and therefore the requirement for physical distancing is very low. In older pupils, there is less certainty about that advice. So we need to engage very closely about the circumstances in which face coverings may be required within or may be appropriate. And I think generally we should take the view that if members of staff or if pupils judged that they would feel more safe or secure operating in that fashion, then we need to be mindful of their concerns and their aspirations in that respect. But that will be part of the detailed dialogue that is ongoing with our partners in taking forward this issue.
Okay, Christine Lavelle from The Sun.
Thank you, First Minister. It was again just on the schools advice that was published this morning. It was just on teachers having to cover their faces in some circumstances. Some teachers have told us today that visors would maybe be better for communication so that children can see their full face when they're explaining things to them. Would you and the Deputy First Minister prefer this as an option to the kind of the textiled face coverings? Visors would obviously be more expensive, and would you provide funds for these?
This shouldn't be driven by cost. I mean, we need to arrive at the right decisions here, and I think it's, I know and absolutely understand there's intense interest in the evidence and the advice that's been published today. But as we've said on a number of occasions now, we need to have detailed dialogue and discussions to turn that into practical guidance. And a lot of these issues will, our position on these will emerge from that process of discussion. But it's a reasonable point. Not just visors versus face coverings. I saw somebody yesterday wearing a face covering that was see-through, because they wanted people to be able to see their face. So there's a whole range of discussions that have to be taken here. And I think, as John just said there may be an extent to which teachers will feel safer in some circumstances wearing face coverings, whether that's a face covering or a visor, although the evidence I'm not sure is exactly the same in terms of these two things. And there may be some limited circumstances. I know the report today talks about where physical distancing that would be recommended is not required, that we may recommend it in those circumstances. So I think what I would say in summary is we're open to all of that. This is, remember what I said earlier, safety and assurance. Making sure that the safety consideration is paramount, but also making sure that people feel assured of that. And so we are open to views such as the one that you have just articulated there, if that is expressed in the context of these discussions. If you want to add.
Nothing to add.
Okay. Derek Keeley from the Courier.
Thank you, First Minister. You spoke last week about the inevitable challenges we're going to face come winter. Are you anticipating those challenges could have any impact when it comes to schools staying open, on the manner in which they stay open? And also, could you give a little bit more detail about what you mean by those challenges? Is that just extra strain in the health service, or like we would see most winters, or are you expecting something else, such as a cold weather resurgence of COVID?
I'll hand over to the Deputy CMO in a minute, who maybe want to say more about just general winter planning, which obviously has a particular, an added element to it this year. On the schools issue, getting schools open and keeping schools open on a full-time basis, we've always said this is predicated on keeping this virus at very low levels. Obviously, if the virus, either through a resurgence of this first wave that we're still in, or because of a second wave later in the year, throughout the winter, then obviously there are different considerations that will come to the fore again. And I'm not going to, stand here and be hypothetical on what all of these might be. But if we want to get schools open on a full-time basis and keep them open, then we must keep this virus suppressed. And I think everybody understands that. In terms of winter, we will potentially face all of the pressures and challenges that the National Health Service always potentially faces in winter. Flu, for example, other respiratory conditions, cold weather that can lead to an increase in people falling and having broken limbs. So all of these add up to significantly added pressure on the health service during winter months. One thing I was reading some information on the other day is that at this stage, Australia, which of course is, I think, in its flu season right now, is not at the moment seeing flu levels at a particularly high level, possibly because of all of the things that people are doing to suppress COVID are also helping to suppress flu. So maybe that's a slight sign of optimism. Harry Burns, the former Chief Medical Officer, is convening a group looking at these concurrent pressures that we might face, and that's feeding into the Chief Medical Officer's advisory group. But obviously we are concerned about the potential for a second wave of COVID, and I have always said that is a real risk that we must be alive to. We don't know that it's definitely going to happen, but we have to plan on the basis that it might. And that involves, firstly, doing everything we can now to mitigate against that. And partly that is about getting it to the lowest possible level now, so that if we do face that, we're in a better position to do that, but also doing all the planning that people would expect us to do to make sure that the health service is prepared. So the NHS Louisa Jordan, for example, will still be available should we need extra hospital capacity. Nicola, do you want to add?
We're certainly aware that there could be greater risks coming into winter. We are anticipating that could be the case and planning accordingly. We know that the virus prefers the cold in terms of how long it's able to survive. That's more of a risk indoors, because outdoors the virus is also sensitive to light. And so it's mainly the fact, I think, that people in the winter will spend more time indoors and it's colder. That theoretically at least means that the coronavirus could be hanging around on surfaces, for example, for longer. So I think that, together with the fact that we know that respiratory viruses are more common in winter, therefore there's the prospect of people getting flu plus coronavirus, and also the fact that because respiratory viruses are more common in winter, we know that more people will have coughs, more people will have temperatures, which means that more people will and should be tested for coronavirus. So I think there's a number of different elements to the reasons why we are alive to the fact that winter could be a challenging time, and we are planning for that. As the First Minister said, we're watching with great interest what happens in the Southern Hemisphere in terms of their winter season, to see whether any of the second or third peaks that are predicted happen there. But we are also taking detailed scientific advice. So we have established a public health threats advisory group, which are looking specifically towards winter and winter planning with the extra risk of COVID. And that's the group that the First Minister has mentioned, chaired by Sir Harry Burns. So they are meeting, in fact, I think they had their first meeting today. So we will be getting the best expert advice on that. I think the other thing coming into winter, of course, is that this is almost the perfect joining of events, if you like, in that we are coming out of lockdown as we are coming into winter. And again, that's why we are being careful about our coming out of lockdown and how we are monitoring that. The hope is that by the time we get to the winter season, that we will be able to see clearly that our measures, our release of lockdown hasn't resulted in any increased transmission of the virus, and it's still under good control before we go into winter. And that's the ideal situation that we want to see ourselves in. And of course, we are keeping everything crossed, as you say, that there will be things like a vaccine to help us as we enter the winter season. But we do still have the flu vaccination programme, and it is still very important, probably more important than ever as we go into winter, that those people who are eligible for the flu vaccine should please take it up this year, given that this is one of the things that we already have in place that can really help to keep our population safer and healthier.
That's a really important last point that Nicola's made there, and one you will hear us talk a lot more about in the weeks to come, about the importance every year, but this year in particular, of getting your flu vaccine if you're in one of the eligible groups. Tom Gordon from the Herald.
Thank you, First Minister. There's another question for the Education Secretary about schools. The scientific advice today talks about there ought to be zero tolerance of symptoms, and that if any positive cases are detected in schools, extensive contact tracing should be undertaken with possible implications for the whole school community. Does that mean a positive case at a school could result in the school closing or moving wholesale to blended learning, at least until it's established who has the virus and who doesn't?
It may not be a single positive case, but these kind of scenarios, of course, can't be ruled out at all, John.
Yeah, I think the advice sets out the importance of there being a great deal of care taken by families as to whether it's appropriate to send children to school if they are in any way presenting themselves as being ill, and that applies also to staff. And that's an important mitigating factor in ensuring the safety of schools and the health of everybody who's involved in a school. Now, when it comes to the decisions that would be taken, should there be outbreaks in individual schools, we just published as a government yesterday important information about the management and handling of local outbreaks of coronavirus, because this will be a critical aspect of our handling of the relaxation of lockdown, that where we see the emergence of particular patterns of infection, we have to be prepared as a country to take decisive action to protect the wider interests of the country. We want to avoid widespread lockdown if we possibly can do. So therefore, taking targeted action, and that's what we published yesterday, sets out targeted action to make sure that we can address the emergence of any particular clusters or cases, will be critical to the management of coronavirus on an ongoing basis.
Thanks, Sean. And the last question today is from Kieran Andrews at the Times.
Thank you very much, First Minister. The report talks about the serious and potentially long-term mental health impact on children of lockdown. Given that more than a third of children who tried to book mental health appointments are waiting more than 18 weeks, according to the most recent ISD Scotland figures, what steps are going to be taken by the Scottish Government to make sure that with a potential upsurge in demand, children and young people get the support that they need?
It's a good and important question, Kieran. As you know, before the pandemic hit us, the Scottish Government was already investing in a redesign, effectively, of child and adolescent mental health services, with much more of a focus on early intervention and prevention, with, for example, the establishment of the wellbeing service, the employment of more counsellors in schools, and that also then means that the specialist services are more able to focus on those children and young people who need access to that specialism. That work becomes more important and will have a huge focus from the government as we go into the recovery phase from coronavirus. I think it's fair to say that's true of mental health generally, but that particular focus on children and adolescents is also really important. Nicola, do you want to say any more about that?
No, I think it's an absolutely vital point, and I think it underpins the emphasis that we have put on child and adolescent mental health in recent times, and it's never going to be more important than going forward. So I completely agree. I think this is an area where we need great focus in order to support young people as best we can as we're coming out of this coronavirus stage.
So the Mental Health Minister and Government generally will be setting out both the progress of the work that was already in train, but also the additional steps we will take in the period ahead to make sure that the additional pressure of lockdown and COVID is recognised in how we cater for the needs of young people. That concludes the questions today. So my thanks to the Deputy First Minister and to the Deputy Chief Medical Officer for joining me today. My thanks to Robert, who has been our BSL interpreter today, and my thanks as always to the journalists. Before I leave you today, there is one other issue I want to update you on, which relates to a temporary change to the regularity of these daily briefings. For the next 2 weeks, we are going to be moving to 3 briefings a week on Tuesdays, Wednesdays and Thursdays. And that means there will be no briefing tomorrow or on Monday. I will next see you here on Tuesday. The reason for that is when you watch these briefings, you see those of us who stand at the podiums, but these briefings involve a lot of work on the part of people behind the camera. And this allows us to give people a bit of a break over the next 2 weekends in the summer period. We will return to 5-day-a-week briefings at the start of August as we go into that period running up to the return of schools, where I am sure there will be a lot of questions, not just from the journalists, but parents and young people in particular will want to hear regular updates about our progress there. So we do intend to return to the 5-day-a-week briefing, but we intend to give people a little bit of a break over the next 2 weekends before we go into that next, I'm sure, very busy period. One other change is that as of Tuesday next week, when I return for the next briefing, we will be at the slightly earlier time of 12:15 every day, and that is likely to be a permanent change. So try to remember, if you are planning on tuning in, to tune in just that 15 minutes early to get the update that we will give you. Obviously, for Mondays and Fridays for the next 2 weeks, we will put out the daily update through the Scottish Government website. My thanks to all of you for joining us today, and as always for complying with all the guidance we ask you to comply with, and that's the note I will leave you on. We are making so much good progress here, and we must make sure it continues. So please remember facts: face coverings, avoid crowded places, clean your hands, clean hard surfaces, 2 metres distance, and self-isolate and get a test if you have symptoms. I can't stress this enough. If we all stick to these 5 basic measures, then it is possible for us to keep this virus under control and to get that greater normality back into our lives, with perhaps the greatest prize of all is to have children and young people back in full-time education come the middle of August. Thank you very much, and I will see you again on Tuesday at 12:15.